I'm Joseph Alpert, Editor-in-Chief of the American Journal of Medicine, and I wanted to take a few moments of your time to call attention to what I think is one of the very interesting articles in this month's AJM. It comes from an academic group in Beijing, capital, of course, of China, and looked at patients who develop inflammatory bowel disease when they're in an elderly range. Of course, many patients with Crohn's disease, ulcerative colitis, develop it in early years, and teenagers with this can become very sick. But it's interesting that it can also develop in elderly patients. It's usually a little more benign in elderly patients, and there's been some just talk about that maybe vitamin D supplementation and keeping vitamin D levels high might benefit these patients with elderly onset inflammatory bowel disease, that is ulcerative colitis and Crohn's disease. So, of course, they did a randomized controlled trial, and there was no difference. Vitamin D didn't make a difference. So there's a vitamin D discussion goes on. There was also just something, recently on the internet, also from China, that sometimes vitamin D supplementation helps with nighttime cramps. So the vitamin D discussions are still going to go on, but in any case, it didn't benefit, didn't harm, but it didn't benefit patients who had late adult onset inflammatory bowel disease. Please stay in touch with us through all of our social media, our website, and so forth, and I look forward to talking with you again next week.